Hi, I'm Cecilia, and I recommend that you watch the first training video, which is the introduction that explains more in detail as to what we're doing. This video is aimed at demonstrating some of the techniques to help you in doing the massage. Now, the model for today, she has volunteered to be our model, and she has chosen to be a sex abuse case. And in the introduction, I explain when you would start with the feet and when you would start with the hands. You would start with the feet if the person had trauma to their torso and head. You always start from the furthest point of the location. So in this case, with her choosing to be a sex abuse case, we are going to start with the hands and come to this area later. This is fully explained in the introduction DVD, so please look at that before you start with the training DVD. Now, as explained as well, most victims that have been raped or sexually abused may choose to stay robed in short t-shirt and shorts. That's entirely up to them. If they wish to disrobe, that is fine. The drapings will still be the same. In this case, our model for today has chosen to stay clothed in a t-shirt and shorts. So I will drape her arm. Now remember that I have just got this. Depending on the size of the body, you may work from the side, or depending on how large the person is, you may want to rest their arm on your leg. But there can be a problem, because again, if it's been a body violation, they may not want this touch. So I merely did this to demonstrate that the best way would be like this, so that they are totally within their own space. But you may work with a large male or female that takes up most of the space on the bed, and there is no space for their arm. And then if it's acceptable to them, you may want to rest it like this. So in this case, there is sufficient room. And now we will work from the hand down. The body will be divided, the arm will be divided in three sections. So this will be section 1, this will be section 2, and this will be section 3. Again, it is to settle the psyche, and again, it is to allow the body to realize that we are friends and not foe. As explained in the introduction, my hand that I'm using in a victim's case with somebody else was actually the weapon. And so you don't want to go up. And this is why, if they were injured, abused, hurt, bashed, smashed, whatever, in the face, you don't want to work up immediately to that area. The reason I'm also sitting, normally with massage, we will be standing and we will be doing a massage up towards the heart. But I do not want movement towards her. Please remember that this whole thing is based on reversing the psyche. Now, the trauma that the person has experienced is in cell memory. And so in reversing, what we're doing is everything in reverse to going to the body. So we are moving away. So instead of me being intimidating to the body in these actions, I choose to sit where I can very calmly work with her. I have chosen to use an herbal cream or lotion that is made with organic oils and essential oils. The oils have been chosen specifically to balance as well. And the most important thing is to work away from the body. And you don't need to be trained in exact techniques. It's very easy to do. As long as you're not going up, you are working back. In doing this, the body realizes that there's no threat. There's absolutely no threat to the body. And the client will relax very quickly. This is why this technique is proven to be very successful. It is the way in which it's done. It's not what you do, it's the way in which you do it. So whichever techniques, I choose to gently massage the hand. I leave the client to relax as much as possible, and I will work the fingers. How long you choose to work on that is up to you. I like to take my time. The massage in total is an hour. I call it the trauma massage because even though it's not the traditional massage, it is still involved. And in working with the client, everything you do that is relaxing will help, as long as you remember to work away from the body. And for the purpose of the demonstration, it may not take an hour, as long as you understand the principle and you know what to do. So I choose to massage, and I will also, in a real situation, check back with the client if she's comfortable. I will check back with the person if the hand massage is soothing. And before I move further from this area to this area, I will check first with them if they're ready for me to come closer to the body. You need to understand that before I started the treatment, I would have had an interview with the client and explained the techniques to them as I have explained it to you in my introduction. I will explain to the client that they need to tell me if they're ready for me to work from the next section. If they say no, they still want me to stay on their hands or their feet, I will do so. The minute they're ready for me to move further, I will start and just gently again move away and then incorporate the hands into this area. By the time I get from this section, I will be incorporating all the areas that I've worked on. So for now, I will just work on her and explain more as I go. Now, depending on their situation, on what they suffered, you may need to change a few techniques. For instance, with a rape victim, they may not want you to go further than that, because if they were heavily injured in the breast area with the female, she may, in the first treatment, only want you to do hands and arms. And then that is all you do. Sometimes you may only do hands. Later on, at second treatment, you may be able to come to here. Depending on the person, depending on their strength, depending on their emotions, they may allow you to immediately come into the third area on the first treatment. All the victims that I worked on, all the clients that I worked on, my case histories, I was able to work fully on their bodies. And that was because they understood what I was doing. They were willing to work with me. And that makes a huge difference when the client is willing to work with the therapist. It makes a difference. If there is some form of resistance, if they're not comfortable, you will feel it because they will tense up. You'll feel it in their hands, you can see it in their feet, you can see it in their face. And if they're relaxed and they say that they're comfortable with what you're doing, then you can proceed to the next situation. Now, even though I'm slightly just working up, I am still coming down. So there's no threat, absolutely no threat. I have no music playing at the moment because I'm speaking, but under normal circumstances there would be very soft, gentle music in the background that would be soothing as well. In situations like this, I will find out from the client, I'll establish what kind of music they like, and I will try and accommodate them with the type of music they like, because music is extremely soothing. I'm now going to come on to the third section of the arm and continue down. Again, I am not over the client. There's no threat at all from my side. I am keeping my distance and I'm working. And now I'm incorporating the entire arm. Again, with the arm on this side, getting close to the breast area, there may be a bit of tension. It depends again on how long ago it was, the incidents, how long ago it was, how severe it was, and that you'd have to take from the client again. If you pick up that the client is tensing in coming into this area, then it's better to move the arm out and work away from the body, still staying away from the body. If they are comfortable with you doing what you are, then it's okay to stay here so that the arm is rested. Very soothing as well are hot rocks. As explained in the introduction, hot rocks are incredibly soothing. Heat, music, it's relaxation to the body, to the soul, to the mind, to everything. And again, we're not trying to stimulate. Our goal is not to stimulate circulation, unblock nerve endings, get lymph going at this stage. Our aim is to reach the body's psyche on a much deeper level, on the conscious and unconscious level, to reverse what was done. When the body is threatened, when a person threatens the body, that body is invaded, their space is invaded without their permission. And this is why here everything we do and getting their permission is so important. Once we have established this and we have reversed, we can then do a normal massage, which can be Swedish massage, can be a therapeutic aromatherapy massage, it can be deep tissue at a later stage, but you definitely would not come at this point in time with deep tissue. The body has been injured, and the minute you go beyond that pain threshold, not that deep tissue is necessarily painful, but it is deep, and a lot of people like it. Some people will recover quicker than others and then go into and may require or ask you to do more. But at this point in time, we're merely concentrating on reversing the invasion that was done on the body by letting the psyche know the person is safe. Our touch is therapeutic, it is not threatening, and there's nothing harmful that will be happening. Once you've massaged the hand sufficiently to the client's satisfaction, and you want to use hot rocks. They are extremely therapeutic and they're wonderful to use. And again, even though my strokes may seam up, my emphasis is on coming down on the hand. Hot rocks, good music, sometimes water, hydrotherapy, all of these are therapeutic. If the person chooses to, before massage, let them relax their feet in warm water with some essential oils, that too is recommended. So again, in a therapeutic manner. And what is also nice is you may, when you're done with this arm and you want to continue with the other arm, you may want to leave a hot rock when it has cooled down to a comfortable temperature. You only use it on the skin in a comfortable temperature. You may want to leave it in their hand so that they can be warm, and then re-drape them again. I'm now ready to drape my client to do her legs. And as in any massage, you drape carefully, not to expose except for the area that you will be working on. Now, my model has chosen to wear shorts, and I will only drape in accordance with what her boundaries are, with what she's allowed me to do. I will not take her boundaries and increase it, because then I'm doing exactly what I'm trying to avoid, and that's invading her space or her body. So depending here on you as the therapist, it depends on your height, what you're used to. You can stand and work the body, and as you work into the sections, or you can remain seated. Very often, remaining seated is again less threatening and very calming for the client, but it depends entirely on you as a therapist. So I will demonstrate in doing basically half and half. So I will start with the feet, and again just work down, massaging the feet, very soothing, very relaxing, and working towards the toes, not going up towards the body, staying away from the area of initial invasion. Whichever techniques you have learned, if you are a qualified therapist and you have learned massage techniques and you want to apply them, if you are somebody who wants to work on family and you've not done this before, it's not difficult to get people comfortable with what you are doing. Again, you can check with them if everything is soothing and relaxing, because that is the main objective. Depending on the severity of the case, it will determine how long you will work on the feet. Don't rush it, because through the feet you reach all the reflex areas that are situated in the foot that you're working on, and these reflex areas relate and correspond to all the organs, glands, and muscles of the body. So this is a perfect opportunity for you to be able to reach deeper than just the trauma massage. So spend time on working the feet and work them well. Again, focusing on keeping your client relaxed. Once you have worked sufficiently, you can find out from your client by asking whether they are ready for you to move onto stage 1 of the legs, which would be from ankles to knee. From knee to thigh is stage 2. So again, we will continue by working from here now, incorporating from the knees, incorporating. This is where I will now prefer to stand. Once I've done the feet, I will prefer to work the legs, and again concentrating on downward movements, getting the leg to relax. Depending on which techniques you want to use, as long as it's important that you understand at this point, we do not, as in normal massage, move towards the torso, because again, the psyche, you threaten the person, they close down. Tension will set in, even though they may not tell you and they may not even be aware of it, but we are concentrating on the psyche. Once you've worked this area sufficiently, you can move on, and I am working in this demonstration maybe shorter, much shorter duration than I would under normal circumstances of doing the treatment. Now, when you work with, again, sexually abused and rape victims, please remember that the second stage of the leg, which is now the third part of the treatment, because you've done feet from ankles to knee, you're coming very close to the area that they want to protect. And it's advisable to start from the outside and slowly move in. And even if you tell your client and say, I'm ready to move into the inner leg, are you satisfied with that? Are you ready for me to do that? And you can say, this is what it incorporates, I will show you. Most of the time, because they're there for you to help them, they are ready for you to proceed. Be very careful how you handle this part of the massage if the trauma they suffered was in this region of the body. One thing with young girls and even married women, they sometimes, after their abuse, they have to re-establish themselves with relationships. And this is incredibly hard. Once their psyche is relaxed and they can accept touch, I have found that they are very, very acceptable to normal life again. Under normal massage, again, I would be working up towards the heart, but in this situation, it is the reverse. Once you have done that, and you will work longer than what I'm doing here. Be very careful where your hands go. You can incorporate hot rocks. With the hot rocks, soothing to the body temperature. And relaxing. incorporated with music. The feet, using the hot rocks on the feet, very soothing. Starting again on the outside, working down before approaching the inner side. Once you have done with the feet, you're ready to move on to the neck. With the neck, I have now removed the pillow and I have positioned the client so that she is comfortable. She still has her clothing on as she's chosen until she gets perhaps to her second massage, or even after this, that she may agree to remove it. But whatever her choice is what we go with. The reason we don't start working on her neck with her in the prone position is very often people are attacked from behind. Attackers very seldom come from the front. And when they are down and they don't know what you're going to do with them, it starts a panic within them. So here they're totally aware of where your hands are and what you're doing. Especially victims or clients who experience facial abuse, where maybe they were beaten, they were slapped, children especially, where they had a gun put to their head, where they saw a weapon such as a knife. They want to see what is going on. And so for this reason, we're going to just start. I have lubricated my hands, and just with strokes on the neck, just to relax. Again, allowing them to get used to you. Under normal massage with this, I would have had her draped like that and started working the pecs, but this is not what you do until they are ready to receive a traditional massage. And so with long strokes and just relaxing the neck and using the techniques you want to use, following what I'm doing, just relaxing these occipital muscles. There are 5 sets of tiny, tiny occipital muscles here where there's a lot of stress and tension. And so when you massage and you relax those, immediately the body says, this is good, I like this, I can relax, I can accept it, and they can accept you as a therapist, and they can accept being touched. You can choose to turn their head and massage and relax these muscles, not going deep, no deep tissue work at all. Just relaxation at this point in time. When you get the tension out of the neck, possibly with a second massage, and they are prepared to disrobe, you can come further into these areas and work the trapezius. Once you've worked this side sufficiently, you can work the other side, making certain that your hands are lubricated sufficiently, but not too much that their hair is oily. As they relax, You can assess at the end whether they are ready to turn into pronate, so that you can do their neck with them lying face down. So assuming that my model here is ready for us to do that, I will demonstrate how we will do that. There are other techniques. This is not part of trauma. This is another technique used where we can relax those occipitals by lifting the head onto the tip of the fingers, and then when the muscles relax, the head will automatically and very slowly go back. If you want to slightly stretch the trapezius, you can do that by placing your hands on either side of the shoulders, asking them to take a deep breath, not to lift their head, and as they exhale, you stretch the trapezius to their point of comfort, and hold it for a few seconds, and then relax. Before you are ready to turn them over, you can ask them to take 3 deep breaths while you stimulate the solar plexus. The solar plexus are using this model foot. Solar plexus are right there, where the ball of the foot and the instep, in the middle there, that's the solar plexus. So you will ask them to take 3 deep breaths, breathing in, and you push in, and exhale, and you release. So that is what I'm going to ask my client to do, is take 3 deep breaths, breathe in, release. Breathe in, release. Breathe in and release. She will now turn over, and another thing I need to point out, under normal circumstances, the client, she or he would not be in such a bright room. The lights will be dim, but obviously for the benefit of the video, we had to have the bright lights. Assuming the client at this very early stage has chosen to only disrobe as far as this, then you would work the neck and the shoulders, the area that she is allowed to. And again, concentrating on relaxation techniques. No deep tissue, just simply relaxing her neck and neck muscles. Once she's ready for you to progress, which is what I will show you, we can then take it further. But until she is ready, we do not do anything else. This is, again, a quick demonstration of what can be done. This you would also spend time and relax the client. Very much feel-good strokes. Once they feel good and they're ready for you to disrobe, the massage would actually take a different approach. You would not start with the neck. You would finish with the neck. This was only done because she wanted to go on the first treatment as far as this stage. Assuming that she has been back and she's now ready to have her back massaged, I will show you how we will do that. At this stage, the client has given permission. It may be the first, the second, third treatment, but they've given permission to work the back. And again, it's going to be soothing relaxation techniques. So with the back lubricated, it will be rhythmic and slow techniques. For the sake of the demonstration, I'm going to stay mostly on this side so that I don't distract too much. Effleurage is very soothing and comforting, and instead of deep tissue, I prefer to use therapeutic aromatherapy massage. Until they are ready to go further. Under normal circumstances, I could probably spend half an hour on the back, but for the sake of the demonstration, we are not going to do that. It will be too long. What is important to point out at this stage is the back massage that I did is traditional massage, just using gentle strokes such as effleurage with a little petrissage. It's not what I have devised as such, but the trauma massage up until that point is what I devised to work on the psyche of the body. So in this situation, again, just gentle strokes that will help the client to relax. With this massage, you would finish off with the neck. You can kneel, you can stand, you can sit, depending on your height, depending on what is comfortable for you. And this would be very much the same as what we did previously, but just with more room to work. So instead of being restricted to this area only, we can now incorporate the neck with body strokes. Still not deep tissue until the client is ready for that. The way you find out whether they are ready or not is you simply ask them. If you wanted to, you could turn the client around at this stage and finish off what I did with the section where I did the occipital lift and the trapezius stretch. You don't need to finish the massage at this point with them in pronate position. Polarity balancing is good to do. Please remember that I have asked people, if they learn the trauma massage, to pay it forward. And all you have to do is, once you're comfortable with this and you like it, if you go into your community and you go to clinics or homes, shelters for abused women and children, or where you maybe know even people in your family or friends that have suffered trauma and are suffering from post-traumatic stress. And you can do this, to do it on a pay-forward basis. So if you can do 5 people free of charge and offer them your services, and if there are other people who would like to learn this and they come to the website and they learn the massage and they pay it forward, can you imagine how many people we could reach worldwide? It would be fantastic. So it's my hope that we can do this on a pay-forward basis. Thank you.